Hello, Blair Chiropractic Society members. This is Dr. Hall again. As promised, we're going to let loose our second monthly outside marketing campaign that you can run in your office. And this month, we're going to talk about screening, outside screening. So there's many different components to screening, and the first one is actually setting up a screening spot. You can't screen anywhere unless you have a location to screen at. So the first thing I would do is I would look for stores in your area that are more geared towards health, whether that be Whole Foods Market, Sprouts. Those would be the first ones that you'd want to look at. Gyms can be good. But with that said, any store that has high traffic will work. I've screened in front of about every store you can think of and pulled patients out of the front of Kohl's store, so it doesn't really matter. But obviously, if you screen in an area of people that are more health-minded, your results most likely are going to be higher. So, setting up a screening location. A lot of being successful in getting a screening location has to do with who you're talking to. In other words, the personality of the manager at the store. So first thing you want to do is you want to make a list of stores you want to target in your area, and then call the store up, and sometimes you can find this online. Find out who the store director is. In the case of Whole Foods Market, Sprouts, Henry's, those types of health food stores, you want to find out who the marketing manager is. So make your list, find out who the point of contact is that you want to speak to, call the store before you go. Do not do it over the phone. You're going to be 100 times more successful in person. So find out who the person is you want to talk to, call before you go there to make sure that they're there. Sometimes when you go to the store, they may be there and they're going to tell you they're in a meeting. That's just they're sick and tired of talking to people. So be persistent. That would be the first thing I'd tell you. But so you found the store, you know who the person is, the point of contact, you've called, you know they're there, you show up, what do you want to say to them? So first thing you want to do is obviously introduce yourself, tell them who you are, and you're going to be given scripts that are in a PDF format that are going to come along with this video, so read those over, they're verbatim. But I've found, and this goes with not just setting up a screening spot, but it goes with signing up people at a screening. Smile. Smile. Get these people in some, I don't know, how's the weather at? Gee, Tom, it's really raining out hard here today. I found that when you open people up, you're more likely to get a yes out of them. So try and introduce yourself, make some small talk, and then go into a very simple script. Introduce, hi, I'm Dr. Hall. I run an upper cervical healthcare office in this community, and our office gets into the public about once a month to raise awareness of the upper neck's role in the health process. Now, Tom, the way that we do this, a store like yours allows us to be out in front of the store. It's a value-added service to your shopper, your client. And basically all we do is we put a sign up that has something catchy up there, like how can we help with your migraine headache, or how can we help with your low back pain. Bob, we aren't very forceful with this. We found that people who see the sign and walk over to us that talk about upper cervical, we found that to be more successful than being very aggressive. So don't worry about us being aggressive with your shopper. We're very hands-off. So Bob, and so anyway, they come by, they stop, they look at our sign, they come and ask us questions. We tell them what upper cervical is all about, and that's pretty much the way it goes. Bob, does that sound like something we can do at your store? And you end with that question to them, because they either have to say yes or no. Sometimes they'll say, oh, sure, and boom, you're in. Sometimes they won't say no right away. They'll say something like, well, what is upper cervical? And of course, that gives you an opportunity to educate Bob, because who knows, Bob may become your patient. So I was a little bit verbose there. You want to make it maybe a minute and a half. These are busy people. You want it to be to the point, but you want to end with, Bob, does this sound like something we can do in front of your store? Because you're trying to get a yes or a no. And like I said, you're going to find that there's some people, it doesn't matter what you say, you're going to get a no. It's a numbers game. Find 20 or 30 stores in your location. Go to all of them. Don't get discouraged if you get 5 no's in a row. It's part of the game. I promise you, if you follow the script and you go in there and you have a smile on your face and do some small talk, there's going to be a percentage of those store managers that are going to go, oh, this poor young upper cervical doctor is trying to build his practice. I just want to help him out. Then once you get the screening location, I always offer 50% off to any of the workers in the store, especially the people at Whole Foods that run the vitamin department, because you'll find getting those people into your office, educating them about what you do, sometimes you won't even have to go to the store and that person is going to be sending you 5 new patients a month. So outside screening is highly successful. Don't be afraid of it. It's great. It helps your communication skills. It helps you move through fear boundaries. And I know some of the biggest upper cervical practices that exist in our membership built most of their practice on screening. So go for it.